participants. So just by way of introduction to start with, I am Charlotte. I'm the Patient Advocacy Manager at Leukaemia Care, and today's webinar is Coping with Fatigue, and it's a joint webinar with Lymphoma Action, and Stephen is also joining me as co-chair. Stephen, did you want to introduce yourself very briefly?
Hello everyone, I'm Stephen Scowcroft. I'm the Director of Operations and External Affairs at Lymphoma Action, and we're very pleased to be delivering another shared partnered webinar with Leukaemia Care. So thanks for joining us.
Yes, I think it's our third now, so it's going very well so far. Obviously, we've got a number of speakers today who are going to chat to you about various aspects of fatigue. But just before we start, just some housekeeping things on the screen there. So just to reiterate, we're not using the raise hand function or allowing anyone to share video or audio if you're not a speaker. Please use the chat function, which if you're not familiar with Zoom, you can find that by going to the toolbar either at the bottom or the top of your screen. I think it depends on what device you're using, but you should find it in the black toolbar. And we will actually be asking polls at various points during the webinar. For those of you who are joining us on Facebook Live, you won't be able to participate in those polls directly, obviously, because you're not on Zoom. But I will read the questions out, and if you'd like to respond, we can always pick up those answers later. And if you've got any questions related to the polls, always interested to hear thoughts and opinions, and I will be able to pick up the questions from Facebook still. So I think without further ado, we'll go into the webinar, and I'll allow each of our speakers to introduce themselves as they speak. Our first speaker is Angie Watts. Angie is one of our nurse advisors here at Leukaemia Care and also a research nurse at a hospital in Dudley. So Angie, do you want to kick us off?
Hi everyone, thank you for joining us today. My name is Angela. I'm a specialist nurse. I work in the NHS as a haematology nurse, but I also work with Leukaemia Care, as Charlotte said, nurse advisor. So I'd just like to start by saying my role and how I would look after patients with fatigue. So during my work day, often we're seeing patients that are having chemotherapy. That may be as an inpatient for acute leukemia. That may be patients with lymphoma that are on an outpatient basis. And we would probably be seeing these patients in clinic or in day case. So at any time, any one of us can have fatigue. It can have such an impact upon our quality of life. It affects many areas. So for patients who are having treatment, we would want to make sure that they're eating well, because first of all, if you're not, whatever food you're taking in, that means that you need to have food to have energy. So what you're trying to put in and what nutrition you're able to get, it's important that we have a discussion with patients and that they are open with us to be able to explain, because we want them to be able to talk to your nurse specialist and to your doctor and tell us how you're feeling. So that's not just physical, so emotionally and physically, as we know that stress and anxiety and depression can have an impact upon us and on fatigue, and also as the side effects of chemo can affect every one of us differently. So we want to make sure that we can point the patient in the right direction so that we can give them the correct advice and that we can try and help them and support them through that journey. Particularly as well, it's important, we know that fatigue can impact upon sleep. So sleep is very important for our overall well-being. And, getting up to your appointments, being able to cope with your everyday life. So getting out of bed in the mornings, we know that fatigue can be quite debilitating. And if you're having to look after someone at home, that might be a young child, it might be that you've got teenage children, so it can affect anyone at any time. So it's important that we can understand and put those measures in place. So it's important to be able to have confidence with your haematology team and be able to share your concerns. I know we're going to go into this in a little bit more deeper, so I don't know if you want, I can hand over to the next speaker.
Well, thank you, Angie, for setting the scene nicely. And I think that leads very nicely on into Colin's talk. So Colin is a CML patient who's very kindly offered to share his experience of fatigue with us today. So Colin, please take it away.
Hi, thank you, Charlotte. Yes, I'm Colin Hayes. I was diagnosed with CML in July 2016. And I guess I've come to realise that whilst I'd heard about fatigue before then, I don't think I ever really realised what it was. So that, you know, I guess we've all been through it a little bit or a lot. You know, for me, it was having a good night's sleep, maybe 9-10 hours even, and then when I wake up in the morning, just being feeling absolutely shattered. And that for me was the kind of the first thing, I think, when I thought I really knew kind of what fatigue was. And I must admit, in the early days, I guess when you've got a lot of other things to think about as well, the temptation was just to accept that was the case, and I didn't really know how to do it, how to kind of combat that and cope with it, and just, you know, I wait for kind of days when it didn't really happen. Since then, I think I've kind of, by chance really, and these work for me. They make other things, different things may work for different people, but from my experience, exercise has been quite a big thing, and you know, that's, for me, it's quite counterintuitive really. I'm tired, so why would I go out and try and exercise? But I just feel that, you know, even though immediately afterwards I might feel just as tired as I was at the start of the exercise, over time I think it kind of it builds resilience. I don't know, I don't really understand the science, but for me, exercise is a big thing. So trying to build that into my regular kind of weekly routine, and for me, I know I'm fortunate, and also you need to choose an exercise thing that works for you as well. But for me, that initially was walking, and I used to play golf. I've kind of stopped now, but I used to play golf, and that was quite good to be able to actually just be out for 2-4 hours on a golf course, just doing some exercise. Managed to graduate a little bit into running, which is where I am at the moment. A couple of 5k runs a week. You get that kind of, is it the endorphins or the runner's high that you get, which I think really helps as well, the sense of achievement. I've also tried to carry on with my yoga practice. So I was doing yoga before I was diagnosed. That's been a little bit more problematic, in not so much from a fatigue perspective, but more from a bone and joint pain perspective. Certain inversions and things don't really work for me from a bone and joint perspective in terms of pain. But there are other things that I found with yoga, sun salutations, for example. So that's been my kind of first mechanism, and that kind of has also led into, that tends to keep your mind busy as well. And I've also found that other activities that keep your mind busy, whether it might be reading, might be I don't know, doing a bit of gardening, which I suppose is exercise as well, might be work for me. I work part-time, I work 3 days a week. That I find is quite good for combating fatigue, strangely. Maybe it just takes my mind off it a little bit, and I know I have to kind of do my job. So trying to keep my mind busy is another thing. And diet is something again that I've tried to change, because picking up on what Angie was saying, it's difficult to know how much of an effect it might have had, but I've certainly kind of switched to eating more kind of vegan, vegetarian meals, not just from a fatigue perspective, but just kind of more generally as well. And I think that's helped. It's quite very difficult to actually work out, but you know, sometimes you can do all of these things, and you know, I would encourage people to find whatever, they've tried things to see what might work for you, but sometimes it does, you just can't do anything about it. I find there'll be certain times in the week, maybe if I've worked through feeling fatigued, and I get to the end of the day and I've just got to kind of give into it and just let my body have a bit of a rest. So I think that's the kind of important thing as well, rather than just, you know, accepting that sometimes you do have to give in to it, even if it's just to, you know, just for a couple of hours, just to kind of slow down and do nothing. I think that's quite a valid thing to do. So that,
Great.
yeah, that's my perspective. Yeah.
Thanks, Colin. I think you've given some really great tips, especially the one about finding what works for you. I think that's always an important message when it comes to these things. Everybody's different. Thank you both for setting the scene nicely there. Just to say for everyone listening, we will come back to all our panelists for a Q&A session at the end of the webinar. So if you've got any questions at all for any of them, please pop them in the chat and we'll get to them at the end. But for the main bulk of the webinar, our next speaker is Dr. Anne Johnson from the Bath Centre for Fatigue Services, sorry. And some of you may recognise Anne from previous conferences with Lymphoma Action and Leukaemia Care if you've been around for quite some time. But I'm sure you'll still find the stuff she has to say very, very useful, and we're very happy to have her back for another session. So Anne, please take it away.
Oh, thanks, Charlotte, and thank you to Stephen and Charlotte for inviting me today. It's lovely to see some people. Thanks, Nick, for your help, and lovely to meet Colin and the lovely Andy Watts. We go back away on our road trips. If you have met me before, if I've met you before, do let us know in the chat box. It'd be lovely to know that there are people out there that we know. And I really hope today, it's been a funny old time, and I hope today will make you feel perhaps less lonely with your fatigue, if that's been an issue for you. Okay, so Charlotte has got a set of slides that she's going to share with you all, and I'm going to talk through these, and I'm going to ask Charlotte also to change the screen as we move forwards. Okay, and normally at this point in the day I say who's come the furthest, and I did notice on the chat box that somebody's from Atlanta, and I'm suspecting that's in Georgia. So you get the prize for coming there. Oh, hang on, we've got Colorado here. Not knowing my geography, I'm not sure whether Atlanta or Colorado is the furthest away. I'll let Charlotte work that out in a minute.
I've got no idea. I'll do a quick Google.
Yeah. But lovely that you could all join us, and what a fabulous turnout. And well done to Leukaemia Care and also to Lymphoma UK. Oh, hello. So I'm a consultant occupational therapist in the NHS, and also a Macmillan consultant occupational therapist, because I set up some cancer-related fatigue services, and that's how Leukaemia Care got to know about me, really. So I'm either in Bath working clinically for 3 days a week, or I'm working academically at the University of the West of England in Bristol, where I'm a senior lecturer and also the faculty lead for patient and public involvement in learning and teaching at the university. So I wear many hats, and they're both great jobs. Thanks, Charlotte. Next slide. Cheers. So today we are going to have a whistle-stop tour around fatigue, but hopefully it will give you enough time to take in a few bits and pieces. Don't worry if you don't remember all of this. These are resources that the teams can share with you, and I'm happy for you to have them. A copy of the slides. So we're going to look at, by the end of this session, you should be able to define what cancer-related fatigue is and identify the components of fatigue to better understand its impact, and to have a better awareness of the strategies you might employ personally. And we've got there for your patients, because we know that sometimes we have health professionals joining us as well. So this is for everybody, but predominantly for supporters of the charities. Before we start, I think Charlotte was wanting to ask you a question around how confident you are in managing your fatigue. Do you want me to carry on with that, Charlotte? Do you want me to ask people that, or are you going to go for it?
Let me pop the poll up now. So for those of you on Zoom, you should see a poll pop up now. Those of you on Facebook, please feel free to answer these following questions. I'm going to read them out, and you can type an answer if you're really keen to be involved here. I'll give everybody a couple of minutes to answer them. So the first question is, are you a patient or someone affected by blood cancer directly, a carer, family or friend of a patient or person affected, a healthcare professional or someone else joining us today? How much of an impact would you say fatigue has on your life? either very little, some, or a lot. And I appreciate that's subjective, but just still interesting to hear what you guys think. And then the most important question we're keen to hear about, as we will repeat this at the end of the webinar, is how confident do you feel in managing your fatigue on a scale of 1 to 10, with 1 being not very confident and 10 being completely confident.
I'm not sure people can see that last question, Charlotte, if you want to move your poll down, is that?
I think everybody has to scroll down themselves.
Okay, fine, thank you.
Because I'm scrolling, and if it's not working for you, please do scroll down and you should be able to see the rest of the questions. We've got a good response so far. So we're 92% patients, which I totally expected, but good to see a couple of other people joining. And please, if you've got questions from a perspective of a carer or a healthcare professional, we could definitely answer those as best we can. Most people saying some or a lot of impact on their daily lives, which I'm sure Anne can help you with. And where are we at in terms of confidence? I'd say most people are somewhere in the middle at the moment, of 4 to 6. Let me just share the polling results with everyone so you can all see those results there. So yeah, the most people said about 5 out of 10 on their confidence. So let's see if that improves as we go through the
There's no pressure
today.
No pressure.
I'll close that up, and then we can carry on. Thank you everyone for responding to that. That's really useful to know as a start. Carry on, Anne.
Great. Next slide, please, Charlotte. Okay. So we are going to define and explore how common this fatigue is. And we're going to look at the components of fatigue and its impact on your day-to-day lives, which is why most of you are here, I'm sure, and look at the strategies you might be able to use and employ either for yourself or your significant other or your patients to identify and manage persistent fatigue. And then hopefully we've got some time for questions with Charlotte and the rest of the panel. Next slide, please. So what is fatigue? How common is it? And how fatigue can impact on your daily life. Next slide, please. So exploring fatigue. Now, what is it? Well, it is, and I really want you to take this home if you don't attend to very much else because you're too tired. It is different things to different people. So please don't be swayed by one person saying it's this and you think, oh my goodness, that's not the way it is for me, because it's always multifactorial and it's subjectively defined, which is okay. All right, I've given you permission to defend what it is to you. What is cancer-related fatigue? CRF, well, the National Comprehensive Cancer Network defines it as the following, and I've highlighted the words that are really important for you to be aware of because it will validate your experience. It's a persistent, distressing, subjective sense. That means it's yours. No one else has the right to say that doesn't exist or it's not what you say, because it's yours. And it can be of physical, emotional and or cognitive tiredness or exhaustion that's related to cancer or cancer treatments that's not proportional to recent activity and interferes with usual functioning. And the important thing there is it's multifactorial. It can be physical, emotional fatigue and or cognitive fatigue. Next slide, please. So how common is it? It is, we all experience fatigue and we know it's normal, a normal phenomenon, and we learn how to manage and alleviate this, but chronic or enduring, that's what chronic means, is not normal. That is the sort of fatigue that persists daily and significantly in excess of 3 to 4 months on a day-to-day basis. So investigate that if that's what you're experiencing and take care of yourself. And some of you will have experienced this leading up to diagnosis, as I think Ange began to touch on earlier. So how common is CRF? It is very common for people living with and beyond blood cancers and all sorts of cancers. However, we don't really understand why, but we know it is commonly associated with treatments. Macmillan Cancer Support estimate that up to 90% of anybody who's had a cancer episode will experience significant fatigue. And I've got that in there in case you're thinking, oh my goodness, I'm abnormal, this is not right, or whatever. It is, okay? We run a service for this specific reason, a specialist service to help people manage that fatigue. Next slide, please. Okay, so along the lines of how common it is, it's useful to reflect on when it might occur. And I've just said to you, it might be experienced, and it commonly is before diagnosis as a symptom. You know, if you've had that, you're in a big, massive company, okay? After around the time of diagnosis, it's very classic, and there may be a lot of emotional fatigue for you there. When someone mentions that you've got something like leukemia, then you know, you can't process things, and emotional fatigue can be present then, but other sorts of fatigue too, the cognitive and the physical. During the active treatment phase, we sort of expect that, and people sort of anticipate that they're going to be tired whilst they're going through, you know, chemotherapy or surgical interventions for some sorts of cancers. But during the post-active treatment phase and beyond that, has been to date less well understood. And it is very, very common. So tell your patients, tell your family, tell your friends that fatigue is very common. And I do say to patients who come to our face-to-face days, tell your GP it's very common as well if they say, oh, you should be over it now or whatever, because we've had some stories of that from patients, sadly, from GPs who don't understand. And that's wrong. You just tell them Macmillan Cancer Support says up to 90% of anybody, you know, who's had this sort of treatment, etc., might have it. I've got a very funny face there over a sort of little strap line there. I don't know what that is, Charlotte, actually. Next slide, please. Okay, so it's not surprising then if you've got cognitive, physical and or emotional fatigue, and most people have got some of each of those three bits. All aspects of your life will be disrupted, all of it. Looking after yourself, looking after other people, your personal care, your work, your leisure activities, looking after your family. Next slide, please. Okay, and something called occupational disruption. When I talk about occupation, I don't mean going out to work. As an occupational therapist, I'm talking about anything that occupies your time, as Colin was talking about earlier. An occupational disruption can lead to loss of a sense of self, as we may not be able to do what we want to do, and if we can't do that, and all the things we need to do, we lose our sense of self and feel that we have lost the balance in our lives. So grieving for part of yourself that you feel is no longer accessible at this time is very normal. Next slide, please. Okay. So the impact in coping with fatigue, well, dealing with it can be really complex, as Colin was saying earlier. Do acknowledge this for yourself, and if you're a health professional on this webinar today, for your patients as well. Don't judge. Their fatigue is what it is to them, and that needs to be respected. We have in here something that we put in for the practitioners, which the practitioners can take away from this webinar today, that you can take away the exercise of the 5 minutes of discussing what for you triggers your fatigue. And you can take that back to your workplace and discuss that and what you notice might trigger your fatigue. And traditionally that could come from, based on our face-to-face webinars, work-related issues, family-related issues, social issues, trying to deal with you know, friends who are going through difficult times, may all trigger fatigue. Classically, for people with the conditions on this webinar today, overdoing things cognitively and physically can trigger your fatigue, as can over-worrying about things. Okay, so become aware for yourselves about what triggers your fatigue. Next slide, please. So physical fatigue, what can you notice? You know, physical fatigue is understood easily by others because probably, you know, everybody understands if you go out for a run or, you know, generally speaking, or you're looking after your kids all day, people understand physical fatigue. You get tired, and yeah, people expect it to happen. Emotional fatigue is less perhaps well understood, actually, and I put an MB in there. I take note that healthcare practitioners may be experiencing, you know, emotional fatigue, looking after patients and trying to support them, and also during this difficult time of COVID. And in my own service, I have seen an increase in referrals from healthcare professionals for help with dealing with fatigue. But the cognitive aspects are perhaps less well understood by yourselves and perhaps other people because they're not always visible. So if for you, you're having trouble sorting out your thoughts, or you read a passage in a book 4, 5, 10 times and it's still not going in, or you can't find your words properly and you stumble and you feel a bit stupid about things, it may well be that you have some significant cognitive fatigue that's impacting on you being able to interact and take things in like you used to before you became ill. Next slide, please. So how might you tackle these issues? And this is the practical stuff, really. Colin said earlier about you can't do anything about it sometimes, but I'd love to challenge that and work with Colin on that one. It is really useful for you to have some awareness of your current and available energy levels. But how is this possible? Next slide, please. Okay, now this is a really basic things, but people get this because most of our patients, most of the people, of the 450 people that come through my door in Bath Centre for Fatigue Services, have got a mobile phone, or they've got something that needs charging up, be it an electric drill or whatever. So it's useful to consider yourself a bit like being like a mobile phone. Okay, and we use this metaphor. So if we start at the top left there, where the person's plugging in their mobile phone, you can see the little picture on the screen, which shows that their phone is empty. It's out of juice. Now, this can be like your body. Let's say at the end of a day, that's how your body feels, cognitively, emotionally, physically, because of the experiences you've been through with your illness. Okay. So what you would normally do with your phone is, if we move on to the next box, we've got the plug-in going on there and the battery charging up beautifully. Okay. And then the overnight, normally that's when we would do that. The next day we unplug and you've got a full phone, you're using it for all sorts of things. And then over the course of the day, you've got that nice little wiggly line there where your batteries run down, and then the cycle repeats and you plug back in. Okay, next slide, please. But for you, for reasons yet we don't fully understand, your battery does not fully charge overnight. Okay, and so when you wake, as Colin said earlier, even despite 9 or 10 hours of sleep, he was feeling unrefreshed. Okay, so we've got the poorly phone here with the sticking plaster on it, and the person in the morning thinking, oh my goodness, I've been in bed for 10 hours and I don't feel any better than I did before I went to bed. Now, sleep is a very complex physiological process, which is very difficult for us to promise that we can change the quality of. But what we can do is help you to reorganize your days and your energy usage around the sleep time. Okay, and that's all about sleep hygiene. That's not about having a wash before you go to bed. It's about your routines and how you can best set yourself up to relax before you go to bed and things. And I think we've got some more stuff to do there. Yes, Boone's theory, somebody's just saying there, yes, there is that, which some people will use, and I can explain that later perhaps in the Q&A. Thank you. So it's not about the amount of time you're in bed. This is another soundbite. It's actually about the quality of time. Okay, you can have 5 hours in bed and wake up feeling refreshed. You can have 10 hours in bed feeling unrefreshed. It's very personal. Next slide, please. So what you need to do, because you're already working on perhaps a half charge, and we take measures as people come into the subjective measures from patient reports when they come into our service, and we ask our patients to sort of rate their perceptions of their health, and it usually correlates to how much energy they feel on average they've got in their personal battery. So what you need to do, because you're already starting on the back foot of working with less than 100% of energy in your personal battery to get you through a day, we need to help you recognise what drains your battery and what recharges it that's not sleep, because we know we can't necessarily promise that we can change the quality of sleep, but you need to take some time to do so. Next slide, please. So what we ask our patients to do is to consider what we call high energy activities. They're not bad because we've got them in red writing. It means that they're the ones that drain your battery the most as you go through your day. That's going to be very personal for people. If you've got a lot of cognitive energy, it may be reading is your high energy activity. If cognitive energy, cognitive fatigue is less of a problem, it may be that physical activities such as walking, like Colin was talking about, or running may be your high energy activity. And then we've got the yellow, what we call the yellow activities, which are low energy activities. So relative for you, and this is all personal, what drains your battery but's not quite as draining as what you think would be red, but still nevertheless takes energy, because from the time you swing your feet over the side of the bed in the morning, even that activity, going to the loo, getting dressed, seeing to the dog, putting the washing on, every single occupation that you're involved with will drain something to a greater or less degree from your personal battery. So number 3 is the bit that's really interesting, because we ask people, what restores your battery, i.e. what feels to you like you've plugged yourself in for a bit that's not sleep. Okay, and that, as Colin was saying, can be counterintuitive, because we're certainly not advocating that you need to lie down flat on the floor in a darkened room to do that. It may be that actually getting outside in the fresh air, getting some white light on you, you know, if you can manage it, going for a walk around the block, is something that actually recharges you both physically and emotionally. It is very personal. What you need to remember is you need to think about now your physical, emotional and or cognitive fatigue. Now, to accept that this is going on for you doesn't mean that you're giving in to cancer-related fatigue. What it means is you're becoming more mindful, and you don't have to like the fact that you're compromised, but if you can accept it to a degree, you will get rid of the emotional burden and baggage that stops you from moving forwards, because you're comparing yourself to prior levels of performance and expectation. Next slide, please. So this is what we use at Bath Centre for Fatigue Services. We've got this little log here, but before people start colouring it in, the hours there, you've got Monday to Sunday, you've got a 24-hour slot there. We ask people to take a couple of weeks to define their high, low and restorative activities, so that they don't have to laboriously write that all down on a diary or a log like this. And then what you can do is you can begin to colour your time in and how you're using you know, your energies. Why is that important? Because it gives us, we work with our patients to work out how much high energy they've got on an average day. We calculate that across a week. If they are regularly crashing and what we call boom and busting, then it will help us to advise about high energy baselines for them to play around and get to know their bodies and their personal batteries better. Next slide, please. So, there is evidence, okay, to say, emerging evidence to say that physical activity, and it was interesting what Colin said and Nick before we came online about exercise. I think it was Nick that said to me, well, I do gardening, but I suppose you could call that exercise. Well, yeah, let's reframe it. Physical activity is stuff that takes physical energy. You will not, all of you assembled here on this webinar, all 136 of you, won't be able to do what Colin can do. And that's fab for Colin, because it's a meaningful occupation for Colin, going for a run. But there are going to be lots of people on this webinar who think, oh my gosh, you know, I should be running and I can't. No, okay, we're all different. Your physical activity could be mowing the lawn. It could be taking your baby in the pram around the block. The thing on the right is a bit of a contraption. Is a bicycle lawnmower. Not something I've used, but you know, if it floats your boat, that's all right for as far as I'm concerned. The evidence from, and that is advocated by NHS England in terms of physical activity, is that 150 minutes a week of moderate physical activity may help to reduce cancer-related fatigue. Now, what is that though? You go, yeah, well, she's a health professional. What the hell's that? Okay, so moderate physical activity is the sort that you do where you get out of breath, but you can still talk. So if you're mowing your lawn vigorously, it's a bit like that extreme ironing on the motorway, isn't it? Moderate lawn mowing is where you're getting out of breath. Okay, so you're getting a bit of training effect going on there, but you're still able to speak. Now, my only caution with that is if you do have some respiratory involvement there, obviously, do check that with your team. If you're at all worried about, you know, the thought of getting out of breath. But as I say, needn't be in a gym. And also just to tell you that Macmillan Cancer Support, macmillan.org.uk, have published a systematic review of physical activity and cancer. So do have a look on the Macmillan website, because some fantastic things on there that you can get for free. Next slide, please. Okay, so how to top up your battery. So any occupation or activity that is meaningful to you and makes you feel restored. That's the thing, as I said, not sleep. Inject some green activity into your life throughout the day. Now, this is often the thing that we as busy individuals, healthcare professionals, people with these conditions, their families, you forget the good stuff that actually makes you feel topped up. We're very busy, life is busy, culture is busy with communications and phones and people wanting, you know, immediate responses to things. But please, I'm giving you permission to stop, take a breath, and actually think about what for you would classify as green activity. And I don't mean being outdoors, but what I mean is things that make you remember that power cable, your personal power cable going from you into the energy supply. What will give you an injection of green to make you feel lifted emotionally, physically, cognitively, or all three ideally? You need some of that throughout your day. If you can inject some green throughout the day, remember the battery, you will be able to recharge that battery throughout the day and perhaps get to the end of the day feeling in better nick than you did perhaps in the times when you would use all your energy and then get to about 3 o'clock and think, oh my gosh, that's it, I've got to sleep, I've got to lie down. All right, but you have to apply yourself to that. You need to give it some time when you don't feel so fatigued to think about it and to write it on your log. Okay, next slide, please. So establishing routines, we know from some of the research literature, is very helpful. Okay. Okay, so using a diary, or maybe, you know, photocopying our log or making yourself a log. If you've got a regular get up time and a regular go to bed time, if you feel like you're all over the place and you don't know how the hell to sort out this fatigue and your routines, start with the basics. Start with getting up at a regular time, even if you don't feel great, and going to bed at a regular time. If you set those two, you can then use your day to start thinking about pacing your battery and what's in it. Prioritizing your activities. Okay, is the world really going to stop revolving if you don't do 6 sets of washing today instead of doing 2 today, 2 on Friday and 2 on Sunday? Ask yourself that. Okay, planning that in, using your calendar, your log, to plan in when you're going to do the washing. Pacing things. Okay, there was just a chat thing that came up about swimming and about giving that up. I didn't read the whole question, but if you love swimming, breaking that activity up into smaller manageable chunks if you know, health, all things considered, health-wise, you're allowed to go swimming, put your cosy on before you go. Get someone else to drive you there. Spend 15 minutes in the pool rather than an hour like you used to. Take a toweling robe with you. Sit on the side, put the toweling robe on, let that dry most of you off, rather than using your towel, using all your battery energy to do that. You know, there are more ways and ways of grading things and pacing it into chunks to make you regain some of what you've lost. Adopt sleep hygiene principles, and there's loads on the internet. You only have to Google sleep hygiene resources around that. The next one is really important. Be self-compassionate. Okay, quit the keep looking at what you used to be able to do and what you can't do now. If you keep doing that, looking over your shoulder, you won't be mindful about what's going on today, and you'll miss out on having a life now. Similarly, if you keep prophesizing and thinking there's no point in me doing that because in 2 weeks' time I won't be able to do it, or what's going to happen 3 months' time, you will use all your energy worrying about the future, things that may not happen, or grieving for things in the past. Be mindful, live in the present, and make the best use of the energy that you've got to have some quality of life. Look after yourself, have a good balanced diet, graze on healthy snacks as you go through the day. It will keep your energy up. Okay, now unless you've got some food allergies or whatever, that shouldn't be an issue. If you do, have a word with your team again, you know, because they will be able to advise. But for our patients, rather than massive meals, you know, maybe smaller meals more regularly, or as I say, healthy snacks that you will top you up. Introduce relaxation. And you know, we all need time to take a breath, take 5 minutes out. Don't let people pressurize you. Okay, expectations of others can be really, really difficult. You have to learn to be assertive and get that across and explain, do you know what, my battery's, you know, about half flat today. I can't do that with you today. I'd love to do it, but not today. It's okay to do that, but people will expect you perhaps to do what you've always done. So it's up to you to educate, and it's up for us, and that's what us as panelists are doing all the time with health and social care professionals and families, etc. But most importantly, like the grinning donkey and the baboon there and the rabbit, do try and have some fun, okay? Because fun can be forgotten, and you know what? Life gets pretty depressing and pretty dull if you don't have a bit of fun, and learn to laugh at yourself a little bit, okay? Don't expect yourself to be the 110% that you were before you became poorly. Give yourself a day off, you know? Have some fun. Next slide, please. Okay, so being self-compassionate is really important. Everyday coping, our sleep or lack of it, I've talked to you about that. Don't expect yourself to necessarily have really good quality sleep. Look at the sleep hygiene resources, okay? And then that soundbite at the end, think about the expectations of ourselves and other people. Next slide, please. Okay, sleep hygiene, a little bit here about that. Habits and practice that are conducive to sleeping well on a regular basis. Sleeping well, yeah, you notice it hasn't got sleep quality in there, but there's things, as I mentioned earlier, that you can do around it, like establishing get up and go to bed routines that can help. We know that from the literature. Next slide, please. Okay, there is this sleep hygiene index, which I'm not going to go through now because Charlotte will share these with you. But all of those things on that sleep hygiene index there have been taken from a journal of behavioural medicine. And if you do any of those, like working in your bedroom before you go to sleep, you're probably setting yourself up to not have a very good night's sleep. So this is something, we couldn't do it now. It's too much for you to do now this afternoon. But you can take this away and you can look at this and fill it in, and it will indicate then perhaps where you can make some improvements to your sleep routines. Next slide, please. Okay. yeah, be creative in your problem solving when you've gone through the sleep index, okay, and try things out. And as I say, I won't go into all the details now because it's very personal anyway. And if you find that you're not doing any of the things on the sleep index list, fantastic, give yourself a gold star because that's fab. And you know, we'll set yourself up for the best sort of sleep routine that you can. Next slide, please. Okay, so it will impact on your expectations to perform on day-to-day activities, which I've already talked about, and it will also impact on other people's expectations in terms of your participation, perhaps in their day-to-day life. Can't tell you the number of people that have said to me, oh, I've lost friends because I keep cancelling my, you know, social plans, and they got fed up of me now. I can't cope with my boyfriend because he's too demanding, so I've chucked him because the fatigue, you know, is just too much or whatever. It will happen. But you know what? That's right, Francis. You know, you do learn with these conditions who your friends are, okay? And arguably, as painful as that can be, it will give you better quality friends in the longer term. Next slide, please. Okay, so just a quick recap then. You should now be able to provide a description of cancer-related fatigue. It is that multifactorial fatigue that can be physical, cognitive, and emotional in nature. That is very subjective and it's persistent, but it's yours, and it's okay if it's yours, okay? That's not proportional to the sort of activity that you're doing. You might think, well, I've only done that, and look at me, I'm absolutely wiped out. That is normal. Don't beat yourself up about it. I'm validating that for you now. It's your fatigue. Protect it, okay? It can go away, as we know from the research evidence that physical activity is helping with that. The components of fatigue, I've just mentioned them there, the 3 strands. And hopefully now you've got a better awareness of some of the things you can try. And there are some like pacing, planning, prioritizing, thinking of yourself as a mobile phone battery, thinking about what gives, what takes, thinking about sleep hygiene, and you've got some things in there, some resources that you can use in the fullness of time to better manage this for yourself or for the other people that you're living with or your patients if you're a healthcare professional. Next slide, please. Yes, you can, Martin. You can have a copy. Yeah. Okay. That's me, whistle stop tour. I hope that hasn't been too fatiguing. But I think I'll hand back over now to Charlotte, and I hope that timing is okay, Charlotte.
Yes, perfect. Thank you, Anne.
And yeah, over to Charlotte. Thanks for listening, everybody.
I was wondering whether you could just go back onto the spoons theory. I'm not sure everyone can see that comment because I think it's directed just to us panelists, but could you just explain what spoon theory is and whether, you know, other people might find that more useful or less useful than the battery analogy?
Yeah, some people like it, some people don't. So the spoons theory is, you imagine you have, there's a few variations, but imagine you have 5 spoons in your pocket, if you like, or your bag. And when you do things, energy is taken by using 1 spoon. And so if like Colin said, you know, he uses 2 spoons out of his, what he feels, if Colin feels he's got 5 spoons of high energy to use in a day, and he takes 2 of those spoons on a run, then he knows he's only got 3 left for any other high energy stuff that he needs to do. So, you know, however, Colin may have 10 spoons in his bag, you know. So if that makes sense to you, that is absolutely fine. It's another metaphor that people can use, which is perhaps a bit more tangible in their brains. Yeah. Other people have Lego bricks, you know, red, yellow and green Lego bricks, so in the pocket. And then again, it just reminds you, you know, I've used 3 of my red Lego bricks, so I'm not going to go to that party tonight, or I'm not going to go to the pub for 3 hours, I'll go for 1. All right, so that's what spoons theory is.
Great, thank you for clarifying that. I'm sure everyone can pick up whichever one they feel works best for them. So just before we move on to the Q&A section, just to say, Anne was right, we'll distribute slides, and we've also got the log that Anne showed. We've got a version of that on our website, and also Lymphoma Action, I've got a copy, and the sleep hygiene index as well. So hopefully you can all go away and do it all in your own time if you like.
Got some homework now.
Yeah. So just to reiterate, we're not doing raise your hands or allowing anybody to speak on this occasion. It's just a bit too complicated with so many attendees. So please do put your questions in the chat if you can. Ooh, very long ones just popped up. So my first question is to you, Anne, and it's not really related to fatigue directly as such, but it's more about when people may need help from people like yourselves. Like, at what point should they seek further help than perhaps someone like Angie or their haematology team when it comes to fatigue? What would you say to someone sat there thinking, I'm not sure what more I can do, I need some further help?
Yeah, I think it's a very good question. I mean, I think people like Angie and the specialist teams will be able to help the patients identify perhaps when they do need more help, and signpost to resources like on the charity website, both of your charity websites, and also Macmillan Cancer Support do some great stuff actually that is free. So I would encourage people to do that. I mean, I know fatigue services are few and far between, specialised fatigue services. We do take national referrals, so we're happy to do that if their GP is happy to organise for their funding to follow them through. So we can do that, and if patients are not sure, they can contact our service administrator to check that out. But there are lots of resources around, so there's a few options there really, and I think accessing your support groups, like I've come up to Worcester before now, and these days actually are fab for support, and you know, hopefully some of the resources that I've provided today, people can go away and use them themselves. But if they're really struggling, yeah, I would talk to GPs and their specialist teams. Is that okay?
Yeah, great. That's really helpful, I think. Thank you.
Thanks. No, that's really great. And thanks very much for sharing a lot of those really useful concepts and tips and tricks around dealing with some of that. I mean, I got a couple of questions really, but I think one of them, I think kind of taking a step back, I think, you know, obviously we're focusing on leukemia and lymphoma here, but I think as you acknowledged, it is universally accepted that it's not just lymphoma or leukemia that has challenges with fatigue, and whether it's to do with treatment or whether it's to do with symptoms as well, and post-treatment. And actually it's one of the key things for the majority of cancers. So how do you think that's kind of being addressed nationally? Because not everybody has access, even with your offer that you're a national centre, but not everyone has access to a facility or to a service that's like the one that you're part of in their local areas. But do you think that's going to change? What can people do to try to kind of help with that? What can we do as organisations
to lobby for it and things? Yeah, absolutely. Good point. Yeah, it is changing. One of the National Cancer Survivorship Research Initiatives, one of the top 10 issues for research, which was published about 18 months, 2 years ago now, fatigue appears at number 7, so it's in there. So there are lots of people interested in doing research, and there's been some in Denmark recently actually, and again, if people are really interested in that, as I say, there is a systematic review of physical activity, for example, in cancer fatigue on the MAC website. Yeah, it will become better recognised. I think, ironically, the pandemic will make people notice fatigue more. I myself have had about 30 referrals over the last 6 weeks for COVID-related fatigue. So I think fatigue more generally will be better recognised. So that's a sort of weird but positive thing that's come out of it.
It takes a crisis to kind of highlight some of these challenges, doesn't it? Yes.
It does. Also to say that Macmillan do run some free, and I don't know if, I think other charities would do the same, and Angie might know too, do run sort of information days and short sort of support sessions, and I think Lymphoma or Myeloma UK do that sort of thing, don't they? Yeah. So do look on charity websites as well to see what they're offering from a freebie point of view. I mean, from a psychological perspective, there is, of course, this massive increasing access to psychological therapies that people can self-refer to if they would like some anxiety management, you know, and it is not sort of significant to the point where they're really struggling and in trouble. So again, do look at those, discuss them with your GP, because they will know about things like, for example, all the social prescribing agenda now, which is helping people to cope with loneliness and you know, suffering with long-term conditions such as cancer can be, and the leukemias, etc. So it will change. There are centres cropping up. If you're not sure in your own area, my best advice is to look for where your cancer specialist centre is, perhaps for your region, and contact the cancer information services there. They've usually got clinical nurse specialists working there that could signpost them to perhaps services like ourselves or free Macmillan courses that are running. And yeah, I would also say to you, and we do say this to some of our patients because it can be a postcode lottery, is to lobby the commissioners. Lobby commissioners, lobby Health Watch, which is the patient part of the NHS, where patients can, you know, have their say. We're all patients, all of us here assembled on the panel, as well as our 125 people who have joined us. We're all patients at some point in time, and sometimes through lobbying and a collective voice, things can change in your local area if you don't have it. So there are loads of good beacons out there for cancer services. So if you don't have very local services, maybe contact those information centres first.
Thanks.
Thank you for that, Anne. I'm going to turn to Angie and Colin next with my next question. So it's one of the very early questions we had right back before we even started talking on the webinar, was around whether someone was asking whether they would feel fatigue less as their blood results got better. And I'm assuming they were a chronic patient when they were saying that. And I wondered first, Angie, and then I was hoping for Colin's perspective on this, but is that something you hear patients hope a lot, and is there, have you got any sort of comments of hope for that particular patient in terms of their fatigue getting better?
I think from my point of view, obviously patients are monitored during treatment, and yes, we do monitor patients' blood counts. Of course, if one of the problems with having treatment is that you can become anemic, so a patient's haemoglobin can dip, and we would take measures to try and correct that with maybe a blood transfusion if that was required. So there are some things that we can do to correct anemia. So if patients are symptomatic because they get short of breath and their fatigue has increased, so during treatment we would likely to be giving some form of medication infusion, a blood transfusion product that we could do to sort of shorten that time and improve their blood count during that active phase of chemotherapy. Again, we do monitor blood counts after, but again, we would expect those blood counts to have come, because as we know that chemotherapy can add, so patients being fatigued, having chemotherapy will impact upon that as well. So we would expect the blood counts to be more normal, if you like, after their treatment is finished. So there are steps during treatment that we can address that. We probably look as well at you know, maybe their iron levels. There's things that medication wise we might be able to add in, but again, I think it's important to say unpick, and like Anne said, is find out what triggers that fatigue. You know, is it something in their daily routine? So it may be related to the blood counts, but maybe when that chemotherapy, so for patients with chronic leukemia and lymphoma, they may have periods where they're not on treatment, but they may still have fatigue. So it's looking at their routine. You know, is it that you're, like Anne said, the bust and boom, where you are sort of doing all your jobs in the morning and then you're not leaving anything, you know, you're not spreading them out. So I think it is important to speak to your team to say that we can sit down and go through some of the things, some of the practical you know, is your bed upstairs? Are you up and down those stairs all the time? Is it something that we can look at that you can help reduce that fatigue? So it may not just be related around the blood counts, but there are ways of correcting the blood counts should they be low levels during that treatment period.
Great,
I hope that helps.
Yeah, definitely. I think that's explained it. And Colin, does your experience reflect what Andy said there in terms of not always being related to how well you're doing in terms of your cancer?
Yeah, it's strange because I with CML we're always, well, unless you've gone treatment free, but you're generally always on treatment. Admittedly, it's only a TKI, only a tablet a day, but I found at the very beginning when I was diagnosed, I didn't really have any energy. I didn't really have energy before I was diagnosed. But I didn't know why I didn't have energy, but I wasn't actually I wasn't doing very much. I just took 2 or 3 months off work to come to terms with what was happening to me. So I might not have been charged, to use the battery analogy, I might not have been charged up 100%, but I wasn't really doing very much to actually, expend that energy. Since then, so since the first 3 months, it's generally been better, but I am doing more, and I'm back working, albeit part-time. So I think that the kind of the treatments do have an effect as well, because for a year I was on a higher dose of my medication to get my BCR-ABL down, and I realized after about 9 months of that it did the trick, but I had much more fatigue and much more tiredness. So and that I found out was related to having low hemoglobin. My hemoglobin was just pushed down and down. So I think for me it hasn't quite gone in a I was really tired at the beginning, and then it's kind of generally improved. I think probably the trend is down, but I'm doing more things than I was when I was first diagnosed. So and that's been, I suppose, a kind of question at the back of my mind. Is it the leukemia that's causing the fatigue, or is it the treatment for the leukemia, or is it a combination of both? I don't think I've ever, or I can't remember what the answer was to that question. Yeah.
I think just to sort of reiterate what you're saying is, in a way that patients come to us with symptoms to start with, and so you've got those symptoms, and then we're going to give you treatment on top, and you can improve. So fatigue can improve because you're treating the condition, and also, but then you can get cumulative side effects as well from the treatment over, you're having 3 courses or 4 or 6, you can then, it can sort of, those side effects can increase. So again, it's very much maybe that you discuss that with the clinician and the nurse, then you can look at sort of, can you adapt that treatment or modify it in some way so that it helps you with your quality of life. So again, it's sometimes very personal to that person, isn't it? Where it's maybe a balance that you can try and strike a balance.
So that was when I was.
It might fit with what you were saying.
When I was on, when my levels weren't coming down as quickly as perhaps they should, I had a conversation with my hematologist about whether I changed to a much stronger drug, or which would have got them down very quickly, or we arrived at a kind of midpoint where we decided that we would try with a higher dose of the current drug, because I was kind of used to the side effects of that, so I was coping with those fairly well. But over time, that created this side effect, just accumulation of the same side effect, but more often, that I couldn't cope with. So and then we had another conversation, and then I think my hematologist would have preferred that I'd stayed at the high dose for a bit longer to get my levels even lower, but I just you know, we had a quality of life conversation then. And
yeah, and that's important. Is that personal plan really for as an individual patient, is what works for you, what's gonna improve your quality of life, but at the same time the control of the condition that you know you're being treated for. So I think it is very much about that personalization for you as an individual. How do we get you through that treatment? How do we improve your quality of life and your symptoms?
If you haven't gone through that, because I never thought that was an option, that I don't know why I didn't think this, but that I had some input into what medication I was on or what level of medication. But I did, you know, I had an influence in not going on to a stronger drug, which I was quite resistant to for a number of reasons. And also I then had input into actually saying, well, I've had enough of this at the higher, you know, at the 600 milligrams a day instead of 400. So, you know, can we go back down? And unfortunately, since that's happened, which was about a year ago, my levels have carried on down, and I'm down at the next response level. So, you know, that's kind of worked out. You know, it did the trick. But I think sometimes that's it's not something that you think you have well, it certainly wasn't something I thought I had an input into until we had those conversations.
No, I think it is about engaging with it is your fatigue, like Anne said. It is about you. It is about that being subjective. It is about how you are feeling. And I think it is important, though, to sort of, you know, I suppose acknowledge, like Anne said, look at what are we doing, what can be done, how can we change that, how can we make, and it's sort of engaging, isn't it, with your practice clinician, with your family members, and saying, how can we make this better, how can we improve? So like Anne said, it's sort of taking the onus on, isn't it? How can we modify our behaviour? How can we modify our daily routine? But can we look at the medication we're on? And again, that would be on an individual thing with your own clinician.
Yeah, and I had great help from the support group that I'm in, so the online Facebook group that I'm in for CML, and the Hammersmith, you know, physical face-to-face support group, went because that was still going then. That, you know, that really helped as well to get to understand, you know, even if people have been through something not quite the same but similar, it just makes you a bit more informed, I think.
It's how other people have coped and how, you know, what did they do that actually I've never thought of that before. Like you said, you know, some people might think, actually I really enjoyed swimming, can I go back to it? Or someone might have in the garden, or actually having, you know, with your diet and your food, you can't eat because of the side effects, but actually you've got this fatigue, you can't feel well enough to be able to cook something to eat for yourself. But actually, by thinking about, can we refer you to a dietitian, or can you have small meals, little and often, spread it through the day? You know, there's sometimes practical things that we can learn from our you know, support groups, and like you say, on the things like Today and on the charitable websites, picking up that little bit of information that we can take on board and adapt it to our own lifestyle.
Yeah, I mean, I was going to pick up a couple of questions that are coming through the chat, etc., and what we've had in advance. But you know, you'd mentioned it as well, and G, around the challenge with fatigue, and particularly around blood cancer in this context, is that sometimes it might be fatigue that you're recognizing as part of a symptom before you've even been diagnosed, so you kind of got to deal with that. Then there's the treatment, and that brings with it its own kind of fatigue challenges, and then there's the kind of recovering from treatment, whether you finish treatment, and that, I think there's evidence to show that can take a long time. You know,
absolutely,
if you've had say 6 rounds of chemotherapy, that can be a 6 months, a year, just to kind of recover from that. And then the kind of potential long-term impact of either you know, anxiety, fear of recurrence, or just kind of adjusting to what that knock-on effect is. I suppose what really kind of picked up on me is being taken seriously, having your fatigue being taken seriously. And Anne mentioned about kind of, you know, telling that it is common, it is recognised, and a couple of people have asked that question: is it universally recognised? And I think Anna said yes. Kind of, if your GP isn't believing you because they're saying, oh well, you are of a certain age, or you are going through something else, or it's just to be expected, or the worst thing perhaps is having friends and family say, well, if I'm tired, you're tired, I'm tired as well.
Yeah.
But that's not the same thing. How I guess really kind of from Colin's experience, how did you feel that you were kind of taken seriously at that stage? Was it from the very beginning, and therefore you're lucky, or did you have to kind of fight for it? And that's some of the things that Ange's been reflecting.
Yeah, I don't think I had to fight for it. I mean, I'm really lucky. My wife's very, very supportive. She really understands, if I'm having a low energy day, shall we say, she's, especially now, but even from the beginning, she was quick to kind of notice that. So I haven't had much interaction with my GP. In fact, I don't think I've had any interaction with my GP about my leukemia. So I'm really fortunate. I've got an Ange, so my Hillary, my CNS is really, really good, and she specialises in CML. So and my hematologist is really the first thing when we speak. We don't go straight to blood results and stuff like that. He always asks me how I am, and I find for me that is really, really important. So I felt I've never had to fight for it. I think I perhaps would at my GP, and that's only because I think they would see so few leukemia patients, let alone CML patients, that how can they, it's difficult for them to understand. Maybe I'm the only CML person in my practice, for all I know. So I never had to fight for it. But I think what I didn't realize was that I could offer my view. So going back to, I think, to what Anne was saying about, well, we all experience this differently. So my view is the most important thing, really, from my perspective. And other patients who will be the most important from their perspective. So to be able to put that forward and have perhaps a more balanced conversation with my hematologist or my CNS about that, it has been really good. And I think I just didn't realize that I could do that. I'm probably of a generation or of I don't know what it is in my kind of makeup that, if somebody from the medical profession says, well, you should do this, then I wouldn't question it necessarily. But I think when you take a bit of ownership of a condition like this, that is another thing, to take ownership of it and manage it yourself, and to realize that you have got a valid input.
I see that Anne has come back. We were just talking about, I was picking up about the challenge of having your fatigue being taken seriously, and you gave a couple of examples about how people can do that and say that it is common and direct them to that. Is there, that's part of trying to kind of hopefully more people, for other areas or other conditions, fatigue is common as well. So it's not just reliant on Colin and his CML kind of being taken seriously. It's a wider thing. But have you got any particular experience or other ways that people can be taken seriously if that is something that they need to fight for? And it's obviously it's a challenge, and it's fatiguing having to validate that you've got fatigue.
Yeah, it is. Sorry, I left you there. My internet connection went. Fortunately, not in the slides. Yeah, I think for our own patients, but they'll sometimes take along their letters from us to various things, and they'll use them for things like help with claiming benefits, actually, or reasonable adjustments at work. We spend a lot of time writing reports for reasonable adjustments at work. We can meet with employers, etc. If you can't access a service like ours, and we're very aware, that a lot of people won't have access. What I would say is to take some of the literature, get some of the literature, free literature from Macmillan, from your leukemia care and lymphoma, and take it along. Look, GPs are great generalists. They have a tough job, but they don't have a great deal of time to actually spend sort of helping people. There was somebody who's also typed into the chat, that is fatigue universal? Their consultant, not always convinced. Direct them to our website in Bath, so that they can see it. But I mean, goodness me, the consequences of treatment that was published by Macmillan Cancer Support and the literature. Now, that's something else that some of our patients will do, is they will print off a research article going, well, look at that. What's that then? You see, and some medics, if a medic is genuinely wanting to work with you as a partner, okay, they will listen to you. If they've got a problem with power and they think this is a cheeky patient who's like asking for too much and they need to get back sort of where they belong as the patient rather than the equal partner, then that's not good. Okay, we've gone past the days of the medics being godlike and knowing everything. A good medic will say to you, I don't know, Colin, I don't know, Stephen, but what you got there, you know, let's have a look. It might be worth looking at. Okay, and what you're asking, and it takes courage to do that, because most people assume that medics know everything, and they do know a lot, but they don't always know everything, and they certainly won't know what your personal experience of your illness is unless you tell them. And you're right, Stephen, it's sometimes really fatiguing to explain that. I will say to people sometimes, you know, take along an advocate with you, take your partner, take your friend. You know, I've been made lasting power of attorney for a friend of mine because she knows that I will kick backside if she needs an advocate from a health point of view. Do you know what I mean? Take someone with you, write the stuff down before you go. And say, listen, consultant, this is what I want to cover. Did you want to come in there? And
yeah, sorry, I was just going to say that if I, because I spend a lot of time talking to patients with this particular role, but I also see patients in clinic. But I would say, if you could, I say to patients, if you could sort of make a diary almost, so you can. Sometimes there's a pattern that will emerge. So if you notice that, say, you've done a diary and you've been more fatigued, like I think we were talking really before about that, it might be based when you look at it and you look back over 2 weeks. It could be, well, actually, I do that particular thing on a Monday morning or a Wednesday night. It might be that it gives you a pattern, but also even if it doesn't, when you go to that appointment, it's more meaningful because you can focus. These are my concerns, doc, or this is what I think, you know, I've been feeling like this, and I can see that it's getting progressively worse, or actually it's getting a little bit better since I've changed that particular behaviour, or I've not gone to the shops on a Monday morning and carried those shopping bags. But it focuses that appointment and it concentrates it onto the issue that you most want to talk about, because you've got the evidence there and it's written down. So it helps the clinician narrow down what is important to you, what do we need to sort out during this consultation, and then you can focus the time around that particular point. And that's really helpful for the doctor, the nurse, for you as a patient, or you know, it's very important to you because it's high on your list of things that are troubling you. But if you can take that piece of paper or that little piece of diary, well, actually it happened 3 times this last week, and so this, you know, can we do, is there something where we can change? And then I think it focuses that appointment specifically for, you know, it may be a better appointment.
Yeah,
you know,
because you might forget things. You might forget things.
Yes, absolutely. And if you've seen every month or 3 monthly, you can't remember, can you, that what happened a week or 3 weeks ago? So I think it actually brings it to that appointment, and like Anne said, you can actually focus in on it then, and is there something we can do differently to try and help?
And I think that also demonstrates that you're willing to be part of that self-management, really, like Colin was saying earlier, you know, that you're not just going along and passively sitting there for them to sort of go, oh, I think you need your tablets reviewed, I think you need this, that and the other. Yeah, some medics, you know, some health professionals will go, oh, it's them again, you know, they've always got thousands of questions or whatever. But you know what, it's your life, it's your health, it's your body at the end of the day. And, you know, you need to advocate for that. And my best advice is try not to be aggressive. It's easy if you feel you're not being listened to. But, you know, just try and be objective. And like Angie says, say, look, I've had this symptom now every single morning for the last 4 weeks. Is there anything you can help me with that? And if they don't seem to be listening, you know, repeat it and just go, yeah, I know, but, you know, it's still this symptom that's troubling me the most. And I found this bit of information on you know, Leukaemia Care's website saying that this might help, whatever. You know, our patients are authentically our partners. They come to me, they go, should I be having these long-term antibiotics for X, Y, and Z? If I don't know, I will say to her, do you know what, I'm not sure. It's a very good question. I'll try and find out, or find somebody that does know, and take the time to liaise with my medical colleagues to say, should this person for this Lyme disease be having long-term antibiotics or whatever? Okay, so it is new, and I think it's more difficult for perhaps older people, older generations, who think that medics do know everything and need to know everything, but they don't, and things do change, and I think that you've got to be assertive and stick up for yourself without being aggressive, but be objective. Okay, yeah. Use the evidence that's out there.
It's referring early rather than to our allied healthcare professionals, and I think during COVID, I know we're not here to talk about it particularly, but I think it's, you know, we've had more now about headspace, about, you know, taking, if you're having some emotional issues, you know, there's more now working together to be able to pinpoint patients and families in the right direction. So there's hopefully things that are being signposted on obviously the charitable websites that actually I think I'd like to find out a little bit more about that, and as healthcare professionals and you know, everyone working in this speciality can try and point patients in the right direction to, like you said, take that onus on themselves to think, well, actually there's something that I'm feeling a little bit emotional today, but I've seen something that this is a phone number I can ring, or this is where I can read a little bit more about it. And I think it's important that we point patients in the right direction.
We almost made it an hour and a half without mentioning COVID.
Sorry about that. I didn't want to bring it up, but I was saying is there are more stuff online now about headspace and how to agree. Yeah.
And I think healthcare professionals will begin to understand it better, because, you know, with the increasing, COVID-related referrals I've had, the vast majority of those are healthcare professionals.
Yeah.
Okay.
Yeah, exactly. I think we've got time for just one more question before we wrap up. So we've got obviously the last poll to do, and also me and Stephen are just going to go through some of the stuff Leukaemia Care and Lymphoma Action can provide. But final question to both Angie and Anne, and Colin, welcome to comment as well. There are a few people asking about various things they could do in terms of diet or vitamins or substances they can perhaps take that may improve their fatigue. Is maybe Anne, to start with, is there any sort of evidence for this, for any of those things at all?
Yeah, I think probably Angie's the expert on that, actually. I mean, a good healthy balanced diet, a good healthy balanced diet.
I was going to say, I think both of us would agree that we, you know, I said at the beginning that in order to get energy, you need to eat, and it's very difficult, whether that's long-term treatment, short-term treatment, if you're feeling a little bit nauseous, your appetite's poor. But what the clinicians would say, I believe, is that you try to have a well-balanced diet if you can. And there are like supplements as well. We wouldn't want you to take, say, miss a meal to have a supplement, but sometimes you get these nutritional supplements that, rather than if you couldn't, you would want you to eat, but in between maybe have one of these drinks where they have got quite a lot of, you know, the nutritional content maybe a little bit higher, or you've got quite a lot of multivitamins and things in those. But we would want you to maintain a balanced diet, rather than sort of, but in addition to that, it may be that we could refer you to a dietitian that could explain and help you work out what sort of things could give you more nutritional input. You know, I know it sounds, but things where instead of having like a skimmed milk, you could have a full fat milk. So there's ways of adjusting people's diet or food substances to take in where that might give them that fuel to provide that little bit more energy.
I think also we do have some people who have very clearly been tested as being perhaps vitamin D deficient or vitamin B12 deficient, a common one. But again, the teams should pick that up really on blood testing and things, and both of those can be tackled in primary care or in the specialist teams, particularly the vitamin D, which is very easy to sort of replace or up, you know, up the levels of that. So yeah, I mean, unless unless there is something that's identified like that. It's the good, healthy, balanced diet. And again, there's loads of stuff probably on your websites and certainly on Matt Millen, can't get my words out, website about diet and things. But the dietitian, you know, for somebody who's really struggling, as Angie said, and can't chew or whatever, or there's a head and neck involvement of some other sort, dietitian referral is a good one, isn't it?
Yeah.
And Colin, did you want to have the last word of the webinar? Did you have any? You mentioned, for example, you decided to improve your diet. And how did you find that helped?
Well, I lost weight as well, which was good. But yeah, so I went to see a nutritionist just to get some advice and some pointers, and that was really good, and sort of signed up to one of these, or just started looking at kind of healthier meals, particularly kind of vegan meals, which I guess I'd never really thought of before. So I'm not a vegan, but I do eat quite a few vegan meals. I suppose the only thing that I found with the nutritionist, I got a lot of really good advice. She recommended 1 or 2 supplements, and I'm not a great one for taking tablets when I don't need to, or when I think I don't need to anyway. That's a bit of a stubbornness streak, I suppose. But I would say check them with your medical team, because what I found was that some of the things that were, a couple of things that were suggested, which were for improving your gut, I think, they had certain enzymes in them that my team thought might interfere with my drugs, so I might not get the benefit of my drugs. So I would just say, you know, take advice, dietitian, nutrition. I think it's a good place to go if you're like me, you're not too sure. But certainly on the kind of supplement side, I check with my and basically a couple of things that were recommended. He said, well, it's difficult to know, so I'd rather you didn't. It was to do with enzymes, I think.
Yeah, that's good advice, I think.
Yeah.
Great, thank you all so much for joining us. Our panelists have been absolutely fantastic, I think it's fair to say. We're just going to run the poll again while I bring up the final slides. So just to reiterate, we're asking the confidence question again. If you could just give us a bit of feedback on how you feel, how confident you feel in managing your fatigue now, would be really, really helpful for the panelists to see how things have gone. And I will bring up our final slides while that's running. Lots of responses, nearly everyone, so I won't keep it open for too much longer. And again, if you're on Facebook, please do feel free to leave a comment and we'll have a look afterwards. It's looking really good. I'll just end the polling now, since most people have responded. And it's gone up to 7 out of 10 being the most popular response, so an improvement there. So well done to all panelists for that. It was really great to see. I'm glad everybody found it really useful. Just to reiterate again, we are sending out further information and proper feedback forms after the webinar has finished, a couple of days' time, and this recording will be available on YouTube and websites of Lymphoma Action, Leukaemia Care after. So please check that out if you want to watch it again. Thank you to everyone saying thank you. It's lovely to see all the lovely comments. We're just going to very briefly go over some of the extra help and support you can get from Lymphoma Action Leukaemia Cares. A few things noted on screen at the moment. In terms of fatigue, I think these webinars are particularly useful from my perspective, and our website also has a lot of good information. Stephen, did you want to add anything to that?
Yeah, no, in terms of, we both have good resources, as Anne mentioned as well. There are other organisations that have specific resources across cancers as well, and both Lymphoma Action and Leukaemia Care. There's, as we said, there's only so much that we can do as individual organisations to help to kind of raise the profile and the challenges around fatigue in blood cancer. But we are part of wider networks that are looking at this, both with pharma companies as well as with other kind of NHS and cancer organisations, to kind of facilitate the voice of people affected by blood cancer, to ensure that things continue to change in the right direction. And hopefully there is a centre and an Anne in those centres all around the country. So that's something that we're working towards.
Absolutely, yeah. And I noticed a few people chatting in the chat about support groups. So obviously those sort of support services are helpful for both fatigue and non-fatigue issues. So please do continue to use those. And on the screen is listed a whole range of services available from Leukaemia Care and Lymphoma Action. I also just wanted to point out, we at Leukaemia Care have a welfare advice service. So we mentioned earlier, like troubles with employers and with benefits. If fatigue is part of that and you need some advice, please do get in touch with us and we'll do our best to support you with that alongside your doctors such as Anne and Angie. Yeah, Stephen, anything you wanted to add on the support side?
No, some people may have heard of our Live Your Life, Living with and Beyond Lymphoma, and that's again looking at a number of different topics about kind of post-treatment and supporting people in that way. And obviously fatigue is an element of that and the psychosocial impact of that, as well as diet, nutrition, exercise, etc. So look out for those.
Great.
Thanks.
Move to the next slide. There are contact details, which I will leave up for a moment, but you can always go back to the recorded version of the webinar to find out those, or just drop one of us an email, advocacy@Leukaemia Care or information@Lymphoma Action, and we'll get you some support you need. And as Stephen's already mentioned, a whole bunch of other places you can go for support, and Anne's already obviously mentioned Macmillan, but we focused here on other blood cancer charities, but plenty of sources of support, so please do reach out if you are struggling. And I think all that remains to say is thank you again to our wonderful panelists, Angie, Colin and Anne. Thank you for
inviting us.
Some really great talks and great discussion at the end there. Thank you to Stephen for being my co-chair and to Lymphoma Action for working with us. It's been a great collaboration so far, and there'll be another one coming soon.
Yeah, we've got others in the pipeline, haven't we? And
we
so
have
look out
indeed.
for those. Yes.
Yeah, look out for those very soon. And have a lovely evening, everyone. Thank you.